Okay, we are continuing the clinical pelvic assessment. How do we use vaginal examination to depict whether a pelvic is adequate? So, internally, we can do vaginal examination. So, woman is lying down for litotomy positioning for vaginal examination. Then we want to assess the adequacy of the brim. Now, when you take the brim, you want to assess what we call the diagonal conjugates. Okay, how do we do that? When you are doing that, we want to now pass your hands, your two index finger into the vagina to assess the vagina. When you go there, you now pass or run your hands around to pass the hands beneath the lower border of the symphysis pubis, whilst this your thumb is over the symphysis pubis externally. Now the hands that are inside, you are trying to see if you could touch the sacral promontory. Ideally, you are not supposed to touch the sacral promontory. If you touch the sacral promontory, that means that the pelvis is flat. Okay, so it is not adequate enough. Are you getting it? That assesses the brim. Okay, when you come to the cavity, in the cases where the head is not engaged, we're able to assess the adequacy of the cavity by using the hollow of the sacrum. Now we go and assess how the curve of the sacrum comes out. We discussed earlier on our videos that the hollow of the sacrum is there to make the cavity adequate enough. Okay, so when the head is not engaged and you assess it, you want to feel the concavity or the curvature or curve of the sacrum. Are you getting? When it's properly curved, then it's adequate. If it's not properly curved and it's straight, then the pelvic is not adequate. One disadvantage is that if it's straight like that, it inhibits the rotation of the head. Are you getting it? Yes. Then when you want to find out whether the outlet is adequate through vaginal examination, now what you are going to do is to assess the ischial spines. Okay, now if you do the VE and you feel for the ischial spine should not be prominent. It should be well rounded. Okay, not sharp and not also projecting inwards. Once it's very sharp, very sharp, not rounded, projecting inward, it reduces the capacity of the outlet and it doesn't become adequate. Again, you could also assess the pelvic arc. Okay, we said that the two inferior pubic rumors come together to form the pelvic arc. So you assess that pelvic arc. When you assess that pelvic arc, at least it should be able to admit two fingers like this. Okay, it should be wide enough. If it's not able to admit two fingers, it is narrow, then it tells you that the outlet is not adequate. I hope you get it. Yes. So all these, we are going to use the general assessment, the obstetric history, the abdominal examination, the vaginal examination, or to assess how adequate the woman's pelvis is. I hope this will. Stay tuned. Remember to like, comment, share, and give us a follow. Bye.